I'm Sean White, and today we're meditating on the question, is pain just weakness leaving the body? I hate the phrase, pain is just weakness leaving the body. Right? Tell that to someone with a migraine or a gunshot wound. Kidding, of course. I know it's really just a metaphor, meaning that the pain you feel after exercising is a marker of progress that your body is getting stronger, right? Now, sometimes that is accurate, sometimes it's inaccurate, and sometimes the pain you're feeling can mean that something is really wrong. So let's get started talking about pain. There's a couple of different types of pain that we feel in the body. Right? Acute pain is usually caused by an injury, an illness, or a medical procedure. Chronic pain may result from a variety of different health conditions. Neuropathic pain results from nerve damage, and nociceptive pain is caused by tissue damage. Now, this last one is what we'll be talking about today, being that we just started a new year, and many people probably made a resolution to get healthier and therefore joined a gym. Now, if you've never really worked out before, or if you're getting back into working out after a long time, overexertion and muscle soreness is likely to occur. Even people who continuously work out can feel muscle soreness. Right? Now, this pain could be from exercising more than usual, doing higher intensity workouts or longer workouts. It can also occur if we introduce new exercises to our routine. Right? I just had that happen a few weeks ago and had a couple of very uncomfortable days because of it. Now, the pain you feel after workout is called delayed onset muscle soreness, or DOMS as we'll refer to it from here on out, and it's classified as a type 1 muscle strain injury. Now, besides extreme soreness, which usually starts around 12 to 24 hours after working out, other signs of DOMS include reduced range of motion, a temporary decrease in strength, and difficulty performing regular activities such as walking or sitting down. Now, the exact cause of DOMS is unclear, and some experts believe that it may be due to microscopic tears in the muscle fibers. These tears can happen while exercising, and the muscle soreness is the result of the body trying to heal them. So let's talk about what happens to our muscles when we exercise. Muscle tears are quite common, even though it sounds a lot more severe. Right? They're usually quite small and sometimes known as micro tears. So when we tear our muscles during exercise, this disrupts the muscle cell organelles, which activate cells from outside the muscle fibers to come in to help repair the damage. These cells replicate, they mature into grown cells and fuse to the muscle fibers, which form new muscle protein strands. This increases the strength and the visible size of the muscle to help cope with similar physical activity in the future. That's why exercises you may have found difficult at one point become easier later on. This is also what needs to happen to bulk up and create larger muscles. Now, at the same time, other satellite cells are used to heal the already damaged tissues. This healing also helps relieve the soreness from the exercise. Now, all this can take a bit of time, which is why the pain can last a few days, right? Usually the soreness will peak around 24 to 72 hours after exercising, and after that it'll start to diminish and should eventually go away within 5 to 7 days. So what can we do to help relieve muscle soreness? Muscle soreness is normal and rarely requires any sort of medical attention. Like I mentioned, it should go away within a week. Now, during this time, it's best to avoid putting too much strain on the injured muscles. DOMS not only causes pain and inflammation in the body, but may also make you more susceptible to injury. Right? Rest and active recovery are important during this time. You can be all no pain, no gain and try to push through it, but there's a good chance that you can create a more severe injury. The American College of Sports Medicine recommends building up any changes in your exercise routine slowly to reduce the severity of symptoms. Starting slow will give the muscles time to adapt to the changes they are experiencing. Now, I will also say from a nutritional point of view, being that protein is used to build and repair muscle, if you're starting a new strength training routine, increasing your protein intake might be a good idea, especially in the beginning when you're most likely to create the most muscle tears that we're talking about. Now, if you're serious about bulking up, I would also recommend talking to nutritionists because diet plays a huge part in this, and you want to make sure that you're not doing something counterproductive by just not having a good enough diet, right? Now, if you go too hard in the gym and wake up sore, there are a couple of things that you can do. Getting a massage can help increase blood flow to the injured area, which can help promote healing. Taking a warm bath or using a heating pad can do this as well, although heat usually only offers temporary relief. Cold packs or cold water baths or plunges can help with the inflammation and swelling in the muscles, and light exercise can also help. I know it sounds counterintuitive, but it may help reduce the pain. By light exercise, I mean walking or stretching. Nothing crazy, right? And of course, if you're really in a lot of pain and uncomfortable, you can use an over-the-counter pain medication. You could take an aspirin or an ibuprofen, or use a topical ointment like Bengay or Aspercreme. Make sure that you're okay to use them first if you do. You might want to check with your doctor if you're not sure, especially if you're taking any prescribed medications. We do not want to have any bad drug interaction. That defeats the whole purpose here. Right. And most importantly, if the pain does not go away in a few days, or if it becomes chronic, you may want to go have it looked at. Pain isn't always just weakness leaving the body. Sometimes it can be a sign that something is really wrong. Right? It can be very easy to create a severe injury while working out, especially if your body is not used to working out. You know, professional athletes get injured all the time, so there's no reason to think that you can't. Injuries to your lower back, your neck, shoulders, elbows, wrists, knees. These are all really common, and if gone unchecked, can cause a lifetime of problems. So if you're just starting out, go slow, right? Our overall health is a marathon, not a sprint. So think long term. I would also recommend starting with a personal trainer if you're new to a gym, to make sure you're using the equipment properly and that you have proper form. This can also help prevent injuries from occurring. Now, I hope you found this video useful. If you like this video, then click the like button and share it with your friends. If you want to hear more of what I got to say, then subscribe, turn on notifications, and find out when new videos are coming out. And leave me some comments down below. You know, let me know if you have a pain remedy that you like. My wife swears by Aspercreme. She's always trying to get me to use Aspercreme. Don't know why. So until we speak again, be well, be safe, and be kind, everybody.